Good morning, and welcome to our 4th annual Career Pathways in Behavioral Health Explore, Engage, and Connect. We have an exciting few hours planned for you, and our hope is that you'll learn more about the field of behavioral health, the breadth of careers, pathways to reach different positions, and most importantly, we hope we inspire you to enter the field. Today's event is presented by the Behavioral Health Committee for the Northern Colorado Health Sector Partnership, which, not to brag, but I'm the chair of. The sector partnership covers Larimer and Weld counties and brings together partners from healthcare, behavioral health, government, education, and community to solve common challenges and workforce needs in our communities. This event was created to address the need for more behavioral health professionals in our region. I want to thank Larimer County Behavioral Health Services, that's right, North Range Behavioral Health, SummitStone Health Partners, and my buddies at North Point Recovery for sponsoring today's event. Couple housekeeping items. Let me find my spot. The digital event program is linked via QR code on your tables. During the speaker presentations, please put your phones aside to minimize distractions in order to get the most out of the content. Each session will allow time for questions and answers. We have organizations who have resource booths along the edge of the ballroom. Take a minute and stop by and say hello and check in on what they do for our community. We have a stamp card available, and if you get at least 7 stamps from these vendors, we'll enter you in a drawing to win one of 4 $50 Amazon gift cards. You can get anything from Amazon. All attendees will be asked to participate in a survey, which will be coming to you by email after this event. We appreciate your feedback for improvement and other ideas. For those who complete a survey, you'll also be entered to be a part of a drawing for one of these fabulous gift baskets. Make sure to take advantage of the food and drinks that are at the back of the room. And without further ado, let's kick this event off. We're going to start with some pretty great people. You might know them as chief executive officers. I call them CEOs. I'd like to welcome Kim Collins, the CEO of North Range Behavioral Health, and Michael Allen, the CEO of SummitStone Health Partners, to come up here and share some inspiring conversations about how they see themselves in behavioral health.
Good morning, everybody. This is such an exciting event. We get to just talk about careers in behavioral health today. That is fantastic. So Michael and I have been doing this for a hot minute, and we go back a couple of different chapters in our lives, and we were coordinating about what we wanted to say to kind of the future generation of workers. And we thought, gosh, what do we say about our field? So we thought it might be helpful a little bit to start a little bit with our why of why we came into this field, and then just share a couple of other things that we've learned and observed over time working in this amazing and incredible field. So my why actually started when I was 16 years old. My niece was a toddler at the time, and she was in an unsafe environment. My brother was not in that particular relationship any longer, but he certainly was very, very much an active parent. And unfortunately, she ended up being in a position to where she was harmed. And so she got removed, and we went through an entire process, not only with forensic interviews and therapy and emergency departments and SANE kits and all of these other things. And I found myself at 17 on a witness stand in a courtroom advocating for her to come into my brother's care for safety. And I thought, I'm not prepared for this. And how incredible is it that I find myself in this position trying to be her voice and advocating for her safety. So that kind of started me down the path. And as I went through my college experience and my graduate program, I learned more and more and more, not only just about how to advocate for someone in a court system, but just as important, but more importantly in a different way for her, what to do in those private moments when she needed help. Through that entire process, I sat back and I was able to really observe who was there for her when she wondered why these things happened to her, and how she could unpack that and look at it in a different way and learn coping skills so that those were things that did not negatively impact her future path. And I'm so thankful for the helpers that showed up for her during that time. And it was inspiring, and it was exciting, and I thought, wow, that's amazing. So I started to go through the process, and I got my education in this, and I went through practicums and internships and all the things that hopefully many of you will end up experiencing. And since that time, I was a clinician for many years. I worked with youth and families. I worked in the crisis worlds, and then certainly went into generalist work and then into management. And so I've seen behavioral health systems in a lot of different perspectives. And here's what I think I would want to just bestow if you take away nothing else from anything that I share today. It's that it is an incredible honor to show up for someone in their most vulnerable hour. Whether it is in crisis, whether they've been dealing with something that they finally came to the table and thought, okay, I need somebody to help me unpack this. Mental health is a spectrum. There will be days that you don't need support, and there will be days that all of us do. I say to the folks in my agency, I love therapy. I love giving it, and I love getting it. If you have not had the opportunity to receive it, please, 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 put yourself in that client chair, because the healthier you are, the healthier your whole life will be, but then also any future clients that you may have, they will benefit from you being just an amazing and wonderful, healthy, insightful, reflective person in your own right. We have seen recovery achieved. We have seen families healed. We have seen individuals who are on the brink of a death by suicide make different choices and come back from that and heal and learn that they do have worth and value and find their purpose and move forward in really wonderful, amazing, incredible ways in our community. It is such an inspiring moment when you see someone decide to really take that change for themselves. And we're just a small part of it. We're a facilitator in that process, but it is so fulfilling and it is so exciting. And I just wish everyone could have that experience. When I do reflect over my time, there are just certain cases that will always forever be in my heart, because they are the cases where I think miracles have happened. And I don't think that it's about me. I think I was trained to help them be their own miracle, and how incredible and amazing that is. So I look around this room and I see all of our amazing partners, and I know all of them are touching lives every day and are moving families forward every day and are helping the children like my niece find their way forward. And I'm so excited that CSU is having this event, that the partnership has brought everything together, because the generation of tomorrow gets to continue this incredible and amazing legacy. And I'm so thrilled to have been a very small part of it. And I'm so excited to see what the students will do in the next chapter, and how behavioral health can shift and innovate and move forward in a way that we've never seen before. And that's really exciting to me. I'm going to stop talking and let my amazing colleague Michael take it.
Thank you, Kim. I'd echo everything that Kim said, and so I'm glad there's two of us so we don't have to repeat. I want to take a minute, though, and acknowledge that there was a school shooting yesterday in Denver, right? And so I just want to take a moment and acknowledge that maybe you are feeling certain ways today. Maybe you're a little bit scared. Maybe you're a little bit angry. Maybe you're a little bit frustrated. Maybe you're a little bit re-traumatized, right? And so those are all feelings that we might be having, even though it didn't happen to us. It happened close to us. And we've had similar experiences happen in our areas, whether that's a community event like that, a natural disaster, suicide at a school or a job. That's what behavioral health does. We're good at being there for our community to process those feelings and those events and those traumas. And we're there for individuals, we're there for our families, we're there for our communities. And that is one of the beauties of behavioral health, is we are there when folks, like Kim said, are at their most vulnerable. And I think it's important for us to have empathy and compassion to do this work, because it's helpful to be able to step into someone's shoes and honor what it takes really to pick up the phone, to make an appointment, to go online, to text and ask for help. And then they may have to ask for time off work. They may have to get childcare. They may have to take public transportation or ask for a ride or find money for gas. And they have to travel to us maybe or wait on a Zoom call, and they get in a waiting room. And then they meet a total stranger and tell them their most intimate thoughts and feelings and hurts. That's a difficult process. And we get to do that every day, and it really is a privilege and an honor to be able to enter into people's lives in that way. And that's what behavioral health is. You may be asking yourself, well, is there a career for me in behavioral health if I don't want to see clients? And I'd say absolutely yes. I tell our folks in new employee orientation as often as I can be there that I don't care about the title on your badge. I hope your title when you work in behavioral health says caregiver. We are all here for an amazing client experience. If you're paying bills, if you do revenue cycle management, if you're doing accounting, if there's an error there and a bill gets sent out erroneously to a client, that's not a good client experience. If someone comes to our facilities and they don't look good, they don't smell good, they're not kept up, that's not a good client experience. If our cars aren't working or don't start and we're transporting around and they're just not taking care, that's not a good client experience. If our business intelligence group is looking at the data and saying this program's not cutting it as far as our quality, and we cut that program and it wasn't right, that's not a good client experience. So there's lots of ways to contribute to behavioral health besides seeing clients, and it all contributes to the client experience. So I hope we all see ourselves as caregivers in behavioral health. I would also encourage you, like Kim said, to think about, maybe today, maybe in the future, what's your why? I'm here, and I've been in behavioral health for 30 years because my mother is a consumer of mental health services in another state. And my daughter, who's 23, is a consumer of mental health services in another state. And I come to work every day, and I know that someone's mother is walking in one of our clinics, and someone's daughter is walking into one of our clinics. And I want to make sure that they're treated like I would want my mother and my daughter to be treated when they walk in their clinics. And that's really why we do this work. That's my why. Maybe your why is you want to be part of a mission-based organization. Maybe your why is a personal experience like Kim and I shared. Maybe your why is because you want to help people in whatever way possible. Behavioral health is tough. We interact with folks in their most trying, probably their worst day ever. And yet it is super rewarding. And our why can help us get through some of those difficult times. I'm so glad this is happening. Thank you for the invite. This is one of my favorite things to do, is talk to a room full of folks about behavioral health. If I could do this all day long, every day, that'd be my dream job. It is my dream job, actually, but I don't get to do this all the time. So I love doing this. I know it's early. Thank you for coming, and I hope you have a great day. Thank you.